evening and welcome to Chicago Tonight. I'm Paris Schutz.
And I'm Brandis Friedman. On the show tonight,
birth control is basic health care.
A new law takes effect in Illinois in an effort to make birth control more accessible, but it could take time.
COVID cases are once again spiking in nursing homes. What facilities can do to mitigate the surge?
They should rest assured that we are focused.
Jewish Chicagoans ask the U.S. to ramp up security measures inside places of worship after the hostage situation in Texas.
Incarcerated people in Illinois say they are having trouble getting basic items like detergent and toothbrushes. We hear why.
No more utensils in your next takeout or delivery order thanks to a new city ordinance.
The Shedd Aquarium president talks us through a planned $500 million transformation in preparation for its centennial.
You shouldn't have to relinquish your pet because you can't afford, food.
Meet a couple who used their stimulus checks to build a pantry to help struggling pet owners.
The exhibition at 1-2 Prue is an introspection of Chicago.
And how a one-of-a-kind showcase of African and African-American artists ended up in a busy downtown building. But first, some of today's top stories. An alleged gunman involved in a shootout near the University of Chicago is reported to be in critical condition tonight at the UC Medical Center. This after that shootout that occurred between a University of Chicago police officer and the alleged gunman that happened this morning. Police say another 5 people were shot today in 2 other incidents, including an 11-year-old and a 16-year-old. Meanwhile, the Chicago Police Department is reporting 5 people were killed in the city over Dr. Martin Luther King Jr. holiday weekend. In all, 38 people were shot in 32 separate incidents. At least 22 people have been killed in Chicago since the beginning of this year, which is down 27% during the same time period last year. Mayor Lori Lightfoot addressed the cyclical rise and fall of violence at a news conference today.
If we're ever going to break this cycle of a spike and then a trough and a spike and a trough, which really goes back to, I think, the 1970s, we've got to look at the root causes of the violence. What is motivating these mostly young men to pick up a gun and solve, in many instances, very petty disputes with the trigger pull?
And today's event was Mayor Lightfoot's first public appearance since announcing she had tested positive for COVID a week ago. The rollout of 5G, the next generation of cellular technology, is not cleared for takeoff, at least not completely, following pushback over airline safety concerns. AT&T and Verizon are still planning to launch 5G nationwide tomorrow, but will not turn on the signals within 2 miles of airport runways. The concern is that the frequencies used for the new high-speed network could confuse radar altimeters. A number of international airlines announced some cancellations of U.S.-bound flights tomorrow after the Federal Aviation Administration and Boeing warned about flying the 777 jumbo jet amid the 5G rollout. No word on how long the buffers around airports will last. Meanwhile, a new airline is arriving at Midway Airport this spring. Low-cost carrier Frontier Airlines will start flying out of Midway beginning April 28th. That makes 6 airlines operating out of Chicago's smaller airport. And Illinois public health officials report there were nearly 20,500 reported COVID cases today, along with 36 deaths. There have been nearly 2,683,000 total reported COVID cases and 29,350 deaths in this state since the pandemic began. The 7-day test positivity rate statewide is at 15.4%. And the Biden administration quietly launches its website for free at-home COVID tests today. The website covidtest.gov was scheduled to officially go online tomorrow. Americans can order 4 free at-home tests per household that the USPS will deliver. President Joe Biden says the government is purchasing 1 billion at-home tests, but don't expect next-day delivery. They'll ship within 7 to 12 days of ordering. People with private insurance can also get 8 free at-home rapid tests per month at pharmacies and online retailers. And up next, a new law aimed at making birth control more accessible. So please stay with us.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
Illinois has lifted restrictions on abortions in recent years, but other limits on health care and reproductive care specifically remain. Amanda Vinicky joins us now with more on a new law that seeks to change that. Amanda.
Yeah, Paris, birth control is basic health care. So says Katie Feedy. She is the co-founder and director of Illinois Contraceptive Access Now, or ICANN. Birth control obviously used to prevent pregnancy, but she says it has other purposes as well. For example, it can be used to control medical conditions. Even so, it's not always easy for everyone to access.
1 in 3 women has struggled to access birth control during the pandemic due to health centers' limited telehealth infrastructure. For Black and Hispanic women in particular, distrust of the healthcare system due to experiences of discrimination, racism, and/or contraceptive coercion remain a barrier to care. And here in Illinois, 800,000 women aged 15 to 44 with fewer resources live in counties where there are no health centers that offer the full range of contraceptive methods.
Among the barriers, until this month, Illinois required a doctor to prescribe birth control. Not going forward, a new law allows a pharmacist to dispense up to a year's worth of hormonal contraception or self-administered birth control without a prescription from a doctor. But it is not quite over the counter. A trained pharmacist has to have an agreement with a doctor for oversight. The patient must also undergo an evaluation with the pharmacist, and that private counseling could lead the pharmacist to send a patient to a physician. Could be for something like an IUD, could be for other medical intervention. Head of the State Pharmacists Association, which helped to advocate for this law, says that the pandemic has shown the expanded role pharmacists can play in a strained healthcare system.
COVID has definitely helped the country see that pharmacists are a point of access for medical services as well for some. Now, I won't say all because we're not a doctor, we never will be a physician, but we can help with alleviating a lot of the ancillary patient care services, like we've been able to do with point of care testing, specifically with COVID testing, how we've been able to continue to expand with offering vaccinations.
ICANN's other founder, certified nurse midwife Takeout, says these consultations will also provide pharmacists with other opportunities for medical intervention.
It is a great way for somebody who may not access care otherwise to find a trusted provider, get the birth control they need, but then also be bridged to a primary care provider. Because I do want to mention about sexually transmitted infections and the importance of making sure that the pharmacist is also assessing that, right? They should never be withholding it, but then they're also saying, and this is a great place to get tested, including HIV, gonorrhea, and chlamydia, which, in Illinois, historically, we've always had very high prevalence rates.
She says a pharmacist also will be required to check a patient's blood pressure, and that's another opportunity for a health check. But director of the American Life League, Jim Sedlick, says that pharmacists don't have time for thorough consults.
It's a disservice to the women who are looking to get the hormonal birth control, because there are so many dangerous things about the hormonal birth control. And when you go into a doctor's office and you ask the doctor about it, they generally have the time to talk to you and to explain the problems, to explain the fact that the hormonal birth control causes deep vein thrombosis, blood clots that could cause heart attacks or brain aneurysms or pulmonary embolisms.
Sedlick is also concerned that Illinois' new law sets no qualifying minimum age.
A 13-year-old girl, a 12-year-old girl could go into a pharmacist and say, I want the birth control, and can get the prescription if they fill out the paperwork. And unfortunately, they're not adults yet, and they can't make the decisions the way that they should be making the decisions.
He says teens' cognitive thinking just isn't developed enough for them to make long-term choices about their health. But Tao says birth control is safe.
Usually it's a progesterone and an estrogen. And in general, there is a lot of discussion, even globally, about this campaign called Free the Pill, which says that campaign is really about why can't birth control, like in many other countries, you may see it truly over the counter without a prescription. there's a lot of arguments when you think about something like acetaminophen, like a Tylenol. Is that even more dangerous than what could happen if someone took the pill inadvertently, right?
She says that other states have shown that this is safe. Some 17 have a similar law already in effect. Now, even though Illinois' law has been on the books, technically taking effect at the start of this month, it is going to take some time before patients will be able to bypass a doctor in order to access hormonal birth control. There's red tape to go through, federal approval in order for Medicaid recipients to be able to go this path, and then also training that has to happen, as well as practical matters like pharmacies that the head of the state association admits are struggling with staffing, as with so many other industries, as they get up to speed, decide, for example, whether they're going to take walk-up appointments or whether they will require them to be scheduled. It is expected that those with government-backed health insurance will, however, be able to go this route within the next several months. It will be until 2023, however, that those with private insurance will have it required through their insurers. Now, Paris, back to you.
All right, still a ways to go here, Amanda. Thanks very much. And now to Brandis and a cause for concern at Illinois nursing homes. Brandis.
Paris, COVID cases and deaths at U.S. nursing homes are once again on the rise. According to CDC data, Illinois saw its highest ever case rate for nursing home residents this month, surpassing even last winter's surge. Cases among staff have also reached record levels. And while resident deaths are on the rise as well, the numbers are still far short of previous records, even though some caution that deaths are a lagging indicator. Joining us now with more are Tamara Konecka, professor of public health sciences at the University of Chicago, and Joseph Quason, director of nursing at Alden Park Strathmore in Rockford. Thanks to you both for joining us. Tamara Konecka, let's start with you, please. CDC data for the most recent week available shows more than 2,200 COVID cases in Illinois nursing homes, breaking a record set in December 2020. Now, that same week saw 60 resident deaths, much lower than the record of 393 from December 2020. And although, as we just mentioned, deaths are viewed as a lagging indicator. Tamara, what steps can nursing homes take to mitigate the impact of COVID on its residents?
First and foremost, our main tool remains vaccination. So if we remember back a year ago, we were in the midst of the start of a vaccination campaign that prioritized nursing home residents and staff. And that was very successful and caused a dramatic decline in cases and deaths among nursing home residents. But that's not a one-time event, it's really a process. And we have to work a little bit harder to make sure that those vaccination rates among both residents and staff, including now boosters, stay high. And in fact, they've dropped to about 87% among residents and 82% in Illinois among staff. So our first weapon is to just increase those vaccination rates.
Joseph Quason, what has been the impact on your residents and staff?
Mostly staffing has been a major problem for us now. With the increase in cases of COVID, a lot of the staff members have to be off work, and that is putting a constraint on the rest of the staff left behind to pick up the slack.
What does that mean for your residents when you are facing staff shortages like that?
So my building is fully staffed. We have managers, clinical managers who are picking up to extra hours to help with the staffing needs that we have. Also, Alden has gone above and beyond to bring in agency staff to help with this shortage that we have now.
Have you noticed any impact on your residents and their rates of COVID?
So currently we have a 87% rate for vaccination for our residents. Like Tamara said, vaccination being the key for us too. We promoted vaccination throughout the building. We continue to push vaccination. Alden goes further to promote raffles and other programs to help with vaccination in the building. For now, with the managers picking up, clinical managers picking up, and other clinical staff on the floor helping with the staffing need, we're stable right now, but we still have challenges ahead because of the increase in the cases that we have now.
Of course. Tamara Konecka, there have been, nationwide problems of late with getting access to COVID tests and, of course, test results. How does that affect nursing homes?
It's a critical issue for nursing homes. It has been throughout the pandemic. It's important for everybody in the population to be able to access tests and get results in time. But in a congregate setting like nursing homes, it's even more important because, as you can imagine, if we can't know who has COVID, it's really hard to prevent the transmission. So accurate and fast tests are critical.
And Tamara, under a federal mandate upheld by the Supreme Court, healthcare workers like nursing home staff have until the end of next month to get vaccinated or to get an exemption. How might that affect families in Illinois?
Yeah, I think this is a really important step forward. We have had a state mandate since fall for nursing home staff to be vaccinated. But there are exceptions for that, and staff can also choose to test instead. I think the fight against COVID is going to be that much stronger and that much more potent if we can get more staff vaccinated. So I think that'll be a really important step. The one caveat is that while the state rule right now applies to both assisted living and nursing facilities, the federal mandate will not apply to assisted living facilities unless they take Medicaid and Medicare, which most of them don't. And so we'll have to be extra cautious about what happens in assisted living facilities so that those residents and families don't incur higher risk.
And Joseph Quason, do you have any concern that, that what Professor Koneska just mentioned, the difference between nursing homes and the allowances for assisted living facilities, that might cause a loss of staff for you?
Yes, I do. With the current cases, with the vaccination rate that we have, we've promoted a lot of education and materials for our staff to follow the vaccine mandate. A lot of Alden continues to go above and beyond to provide us with the needs that we have. But at this current rate, we are paying 3 times the base rate to get staff to come in and help take care of these residents. With a continuous shortage, there's a competition not only with the assisted living, but the hospitals right now, because the hospitals also need staff and they are paying above the base rate to get these staff members to the hospitals. So in all, we're going to have a staff shortage. We do promote vaccine and we encourage every single staff member to get vaccinated. Currently, I have approximately 15% of my staff who are reluctant to take the vaccine based on personal and religious reasons.
So it sounds like you're already competing to maintain your staffing levels. Do you think the state should change its mandate to eliminate the testing?
Currently, I think the vaccination is that's the best weapon we have against this COVID. What I know based on the knowledge and the CDC guidelines and all the research out there, the more we are not vaccinated, the more these viruses mutate. And today we have Delta, tomorrow we have Omicron. We don't know what we have in the future because of mutation. I personally believe vaccine mandate is very good. We need to put out more education to the public, the general public, about vaccines and how it works and its efficacy. A lot of misinformation out there too, but I think if we have more good peer-reviewed articles and good information out there for the public, it will help with the vaccine mandate.
Okay, that's where we'll have to leave it. Best of luck to you, Joseph Quason. Thanks to you, as well as Professor Tamara Koneska, for joining us.
Thank you.
And now, Paris, back to you.
All right, thanks, Brandis. The weekend attack on a Texas synagogue has reverberated here to Chicago's Jewish community. On Saturday, 4 congregation members were held hostage inside the Congregation of Beth Israel in Colleyville, Texas. They were later released after a rabbi threw a chair at the gunman. Jewish leaders are asking for heightened security and gun safety training following the aftermath of the Texas incident. And joining us now with more are Shoshana Conover, a senior rabbi at Temple Shalom of Chicago, Sarah Van Loon, director of the American Jewish Committee's Chicago Regional Office, and David Goldenberg, Midwest Regional Director of the Anti-Defamation League. Welcome back, all of you, to Chicago tonight. Rabbi Shoshana, I'll start with you. How is your congregation and the Chicago Jewish community at large reacting to what happened this weekend?
Well, I'll just say that we are firstly extraordinarily grateful of this outcome, grateful that all 4 hostages got out safely. Grateful that there were incredible trainings that helped them to do so, and grateful for all of the people who really helped this congregation to be able to be safe. I'll say that at this point, we are also not only grateful, but we also look to the future with greater apprehension. And we know that this has shaken people. This has already been such a tough time with going into winter, with COVID continuing to run rampant. And then to have this kind of an attack, it makes everybody more anxious. And yet there were so many ways to be able to focus on what has been positive from this, and also what we can learn and do better in the future.
Sarah Van Loon, what do Chicago area synagogues or community centers need right now in terms of safety?
Well, they need both increased support from the community at large to be able to take advantage of both statewide and federal resources, but also to have our non-Jewish allies speak out and stand in solidarity with us. AJC right now has a campaign, #United Against Anti-Semitism, where we're calling on all people of goodwill to stand up, to call out anti-Semitism, and to show that it has no place in our homes.
And David, we've since learned that the members of this synagogue in Texas, they had been given safety courses, gun courses, for a situation just like what occurred. Is this commonplace in synagogues throughout America to be fortified like this, to go through training for these situations?
Unfortunately, Paris, it is. It is too often here with synagogues looking to increase their security measures around synagogues, whether it be vestibules or bulletproof glasses or panic buttons. That unfortunately is too common now. And we have a situation here where rabbis like Rabbi Conover not only have to learn and teach Torah, but they also have to learn and teach tactics. And that is a sorry state of affairs of being a Jew in America today.
All right, well, let's hear what President Biden said when he weighed in on this attack on Sunday.
We're not going to tolerate this, that we have this capacity to deal with assaults on particularly the anti-Semitism that has grown up. And so, and I'll be talking with, I put a call into the rabbi. We missed one another on the way up here. And, but they should rest assured that we are focused. We are focused. The Attorney General is focused on making sure that we deal with these kinds of acts.
Rabbi Conover, what kind of conversations do you have with your congregation about safety, about potential situations like this?
Well, we've had trainings and we have further trainings to go. And also we're able to, when we look at how do we keep ourselves safe, we also keep ourselves focused on our mission. And so while we focus on safety, we also focus on reaching out to those who are vulnerable. We continue to study Torah. We continue to welcome in our children. These are the ways in which we stay both safe and also we stay the people that we are with pride and with a great deal of gratitude.
Sarah Van Loon, what are the kinds of things that your organization is offering or providing for synagogues right now to comfort them and for safety?
So one of the things that we're doing is not only just being there for our rabbis and our local area synagogues, but also providing community briefings, anti-Semitism awareness trainings, opportunities for community members to come together and discuss opportunities like this, but really take advantage of the resources that are out there to help connect them with local and state elected officials, again, to help ensure that they get the resources that they need, but also the support that they need for the long term. But this may be our focus today. We understand that anti-Semitism has been around for 2,000 years, so it's not going anywhere anytime soon, and it's going to take all of us working together to combat it in every sense.
All right, well, let's hear what the rabbi in Colleyville, Rabbi Charlie Citron Walker, said about mitigating this incident, throwing the chair in front of the suspected terrorist. Here's what he said on Monday.
It could have been anything, and it turned out that it was his gun. I threw a chair at the gunman, and I headed for the door.
David Goldenberg, when you look at the recent attacks, Tree of Life, Poway, California, does it feel right now like anti-Semitism is worse in your lifetimes or our lifetimes than you've experienced it?
The number of incidents, if we want to quantify it, are definitely up in recent years. If it's worse, I don't know. But what I can say, though, is that too often we're seeing these incidents of harassment and vandalism, and in these cases, assaults, that are growing and increasing to alarming rates, and have really reached a point where we're at a watershed right now. And I think, as Sarah and Rabbi Conover talked about, the idea of being there and supporting for one another, and that we're not going to fight and combat and end anti-Semitism just on our own as a Jewish community. And that is something perhaps that we take a lot from what occurred last week, that it was overwhelming to see the support that members of the Jewish community were receiving across the spectrum. And if we take anything from that, perhaps hopefully it opens up new levels of dialogue, that we're there for one another, not just in crisis, but in times of calm and peace, and moving on from there.
And speaking of being there, Rabbi Conover, what is your message to congregants that are afraid to go to synagogue now, or to community centers, or to go out in public to places like this, given what's going on?
Well, there's one thing to be afraid, and we have to affirm that fear is real, and also that truly the way in which we can go forward and be able to live our lives with both dignity and gratitude, and truly with Torah at our center. It means to be able to gather. It means that we are going to continue to have the kinds of programming that we have always had, and we're going to be vigilant. But we also know that with that level of vigilance, we can gather in safety and in joy, and with great ways of being able to say, we are a community that moves forward. We are not the only victims of hate. And so to be able to gather together both with other Jews and with other people who have been victims of hate, and to be able to stand together as one human family, it's going to be essential for all of us.
And Sarah Van Loon, the reporting to this point is that the suspected attacker here, terrorist, whatever you want to call it, was a British national who was not on the radar of U.S. Law enforcement agencies. What else does the federal government, state, local governments need to do to keep people safer?
Well, they need to continue working together. AJC is calling on the White House to convene a national task force on anti-Semitism and explore ways in which the various federal and state agencies working in concert together can utilize their resources, share the knowledge that they have, so that we can mount the most appropriate response in all regards. We have so much opportunity, we have so much intelligence at our fingertips. We need to make sure that it's starting at the top, that all of us are working together, led by the White House, to ensure safety, not just for Jewish Americans, but for all Americans.
All right, this is an ongoing conversation, but for now, our thanks to Rabbi Shoshana Conover, Sarah Van Loon, and David Goldenberg. Thanks so much for joining us.
Thank you for having us.
Thanks.
And we're back with more right after this.
Thousands of Puerto Ricans are taking to the streets to protest massive blackouts.
Over the years, Mexican culture, from food to music, has become woven into the city's tapestry.
Medical professionals share the latest recommendations on COVID-19 booster shots.
DACA recipients have been facing longer delays than normal in their status renewal.
Little Village is one of my favorite neighborhoods. This neighborhood comes together to celebrate such an important day in our culture.
And there's much more ahead on the program, including an inside look at the Shedd Aquarium's $500 million renovation. But first, it's become more common to see donation boxes across the city. Some are filled with books and others with canned goods. Chicago Tonight's Joanna Hernandez heads to the southwest side to speak with a couple that built a donation box to help people with furry, four-legged friends.
Good girl.
Suzu, can you sit too?
It's a full house at the Alonso home.
Wait. Okay.
There's tons of snacks and playtime for those four-legged pups.
Can you go down? Down?
Carolyn and Gregory Alonso have 4 rescue dogs: Fraser, Bowie, Zuzu, and Lily.
It's wonderful to see rescue dogs come out of their shell, and you're helping that, and you're helping them, have a new life and just meet new dogs and have new experiences. It's not just great for them, it's great for us too.
The Alonsos adopted rescue dogs throughout the years, and when 2 of their dogs died during the pandemic, they wanted to find a way to honor their pets.
So with the pandemic and the civil unrest that was going around at the time, it was just kind of a lot to take in. And so it just came back to me. It's a hard time for everybody. I feel like I need to give back.
We were already involved with so many rescues already,
And we were hearing stories of people relinquishing their pets all of a sudden because I lost my job, I'm losing my apartment, I can't feed them. And, you know, the thought of having to give up one of our dogs for, you know, any reason, it was heartbreaking to us. And that's when we were like, okay, what can we do?
They decided to build a dog pantry and place it outside their home, naming it after one of their departed dogs, Obi's Pantry.
And then Obi was almost 14, and we got him when he was 5. He was special to us. He was always right there at our side. If you were sad, he knew it. He would sit right there with you and make you feel better, and he just had a way of making you laugh.
Using their stimulus checks, Carolyn and Gregory stocked the pantry with all kinds of pet supplies.
Food, treats, you know, the basics, those are important. You shouldn't have to relinquish your pet because you can't afford, you know, food. We want to help lessen the burden.
I just thought it was going to be something we would stock once in a while and not something that we have to check daily. I wish the need for it wasn't there, but as long as it is, we're going to try to be there with it.
Now they're hoping to expand and see more pet donation boxes across the city, keeping their memories of Obi alive.
You never know what doing good can do for yourself until you try. And, you know, and when you do, sometimes you find out there's things out there that you didn't even know about.
The pantry is located near Midway Airport on 64th Street. Anyone is welcome to make donations or grab what they need and pass on the message. For Chicago Tonight, I'm Joanna Hernandez.
And Obi's Pet Pantry is looking for volunteers. You can visit our website for more information. Still to come on Chicago Tonight, how a new city ordinance will affect your next takeout or delivery order. Difficulty accessing basic items for hygiene or snacks. Advocates say that has been the reality for Illinois prison inmates for months. The Shedd Aquarium president talks us through a planned $500 million transformation in preparation for its centennial.
The exhibition at 1-2 Crew is an introspection of Chicago.
And how a one-of-a-kind showcase of African and African-American artists ended up in a busy downtown building. But first, some more of today's top stories. 7 public infrastructure improvement projects across the city have been awarded part of a $10 million prize. The mayor announced the winners this afternoon. Residents submitted 500 ideas that were whittled down to 21 proposals before being presented to the communities as part of the Chicago Works Community Challenge. The projects chosen include 4 Park District facilities, 2 Chicago public school facilities, and a public library branch, which will see improvements in the coming year. Meanwhile, inspectors have cited more than 24 businesses for not enforcing the city's COVID-19 proof of vaccination mandate. 13 bars and restaurants and 9 fitness centers were issued 2 citations, which would trigger a hearing. Fines can range between $100,000 and $10,000 for failing to enforce city rules requiring anyone older than 5 to show proof of vaccination to enter a restaurant, gym, or entertainment venue. And for a list of all the businesses cited, you may visit our website. And now to Paris with possible changes to your next takeout order. Paris.
That's right, Brandis. Starting today, you might notice something missing from your next pickup or delivery order, and that's the pile of utensils and napkins at the bottom of the bag. WTTW News reporter Patty Wetley joins us now to explain. Hey, Patty, so per this new ordinance, single-use plastics are eliminated from takeout and delivery orders, but can someone still get them if they want?
Yeah, this ordinance went into effect today, January 18th. It was passed back in September. People had kind of wanted a bit more to be banned, including like all takeout containers. But this applies to foodware and only for delivery takeout, not dine-in. And some exceptions are if you request them, you can still get them. And also if it's a self-service kind of kiosk, like at a salad bar or something, and you're grabbing them yourselves, you can still obtain them.
All right, so you kind of answered my next question. Does this new ordinance apply then for all other establishments beyond the ones you just mentioned?
Well, you'd be surprised at the list of establishments covered because it includes places like bars and nightclubs. So anywhere that you could pick up or order food from. But some of the notable exemptions are places at O'Hare and Midway. It doesn't apply to them. Drive-through restaurants, it doesn't apply to them. So there definitely are some loopholes here. But I think also it's interesting that it includes more things than just your plastic utensils. It is napkins, like you mentioned. It's condiment packets, so like your ketchup packets, stirrers, wet naps, things like that. Weird exemptions include straws, so you can still get all the straws you want. It's a sort of a mixed bag.
Well, if you're getting a hot dog, who needs those ketchup packets? Anyway, you know,
but you need the napkins.
Well, you do need napkins. So when the plastic bag ban passed years ago in the county, I mean, there were ways of getting around that. So what exactly is a single-use utensil, and can an establishment have a different material and say, well, this is exempt?
I mean, that was the big question that critics of this were blasting. They're like, what's the enforcement mechanism? And they really wanted it to be much broader. It passed with a lot of support from people who said something is better than nothing. So if we can at least eliminate some sporks from the chain of waste, it's better than nothing. So we'll see how this goes.
All right. Patty Wetley, thank you very much.
Thanks, Paris.
And you can read Patty's full story on our website. That's WTTW.com/news. And now, Brandis, we toss it back to you.
Paris, thank you. Incarcerated people in Illinois prisons are having difficulty getting access to basic necessities like hygiene items or detergent. The Illinois Department of Corrections says this is due to a supply chain issue, but advocates point to disputes between IDOC and vendors. Joining us to talk about how this is affecting inmates is Jennifer Vollen-Katz, Executive Director of the John Howard Association of Illinois. We did invite IDOC to join this conversation, but they instead sent a statement saying, quote, IDOC has 5 emergency contracts in place and product is flowing into IDOC's commissaries. Of course, things are being cut due to supply and demand, but we are still moving forward with placing orders and there is product coming in. We are processing commissary orders every day. Jenny Vollen-Katz, good to see you and thank you for joining us. You know, your group has been hearing that, you know, what we just heard from IDOC, you all are hearing that that's not quite sufficient. Give us a sense of what you're hearing from inmates and their families.
Sure, and thank you for having me. Certainly we're aware that the Illinois Department of Corrections has entered into emergency contracts with other commissary vendors, but we are still hearing from the people who are inside, as well as their loved ones and family members, and even from some correctional staff, that the goods are just not flowing in, that even under the emergency contracting situation that we're currently in, there's just not enough supply to meet demand, and we continue to hear from people that they are being deprived of really basic necessities.
And how long has this been a problem?
This has really been going on since this summer. That's when we began to receive reports about the lack of available goods on commissary. We saw it with our own eyes starting in the late summer, early fall, when we were inside monitoring the facilities and saw that the commissary shelves were really empty, and heard from both the people who are incarcerated and staff that this was a real issue. And you know, while there have been some changes and there's been some fits and starts and some goods have made it onto the commissary shelves, it's not nearly enough to satisfy the demand or meet the basic needs of the people who are incarcerated. And we continue to hear that, you know, up until the current day, up until through today.
Give us a sense of what kind of, you know, goods and products we are talking about and why the inmates need them.
Sure. So, you know, one of the common misunderstandings that exists in society is that commissary provides luxury goods to people who are incarcerated, which is just simply not the case at all. The items available on commissary are really hygiene items to augment what the state provides, which is usually considered inadequate. You know, 1 bar of soap, 1 roll of toilet paper, bars of soap are really small, just not enough to get people through a week. As well as things like laundry detergent, shaving cream, writing implements, envelopes so that people can write to their family and loved ones. You know, and food is a really big ticket item. You know, we routinely hear about problems with both quantity and quality of food inside the prisons, and a lot of people rely on commissary as their major source of food. So not being able to get that is really problematic for a lot of people.
Now, on their website, IDOC, and in that statement, they say this is due to a global supply chain issue, but you all have been tracking this, and as you said, you found some contract disputes with vendors, and that is probably what is leading to this vendor shortage. Tell us more about what you found in your research.
Sure. I mean, you know, one of the things that we came to understand pretty quickly is certainly I think we've all seen some global supply chain issues, you know, impacting us in our day-to-day lives, going to the grocery store and not being able to find an item we're looking for. But if we can't find the exact brand we want, we can usually find a replacement item or something quite similar. And so a lot of people that were writing to us, people who are incarcerated, noted that they were being told global supply chain issues were the reason for lack of available goods, but they were hearing from their loved ones on the outside and even from correctional staff that simply wasn't true, that there were goods available. And so when we started asking more questions of the agency, you know, it became clear that, you know, one problem led to another. And in trying to create some consistency across the state and come into compliance with procurement laws that the agency had long been out of compliance with, the changes made led to all sorts of problems and lack of availability of items, necessitating emergency contracts. And it's unclear exactly why those contracts aren't functioning the way they're supposed to. But what we were told by IDOC is that the way the contracts would be managed is that they would be for goods that were immediately available, not for things that they routinely offered, so that they wouldn't continue to be in this situation of running, you know, trying to order things that weren't in stock.
And our colleagues, well, I was just going to mention that our colleagues at WBEZ have also done some reporting that there were some complications with the bidding process that IDOC went through to even establish a contract with one of the vendors. But Jenny, what are you hearing from people inside the prisons about how this shortage affects, you know, their mental and physical health?
They are suffering. You know, during a time of deprivation and isolation, this makes a bad situation far worse. You know, this is a very scary time to be incarcerated anywhere, particularly in Illinois. We're seeing incredibly high COVID positive numbers. We're hearing about some correctional staff deaths due to COVID in the last few weeks. So in all of that, to not be able to get basic goods that allow you to write home, to keep yourself clean, to, you know, nourish yourself, basic things that will help keep people safe and sane is incredibly difficult and demoralizing.
Okay, that's where we'll have to leave it. Jennifer Vollen-Katz at the John Howard Association, thank you for joining us.
Thank you.
Up next, we'll dive into plans for big changes at the Shedd Aquarium. But first, a look at the weather.
Big changes are afoot at the Shedd Aquarium. The Shedd announces that as it builds towards its centennial in 2030, it'll undergo a $500 million transformation. That transformation will be both physical, encompassing major interior renovations to create immersive exhibits, but will also entail a transformation of mission with more educational programming for Chicago school students. And joining us now to tell us more is President and CEO of the Shedd Aquarium, Bridget Coughlin. Bridget Coughlin, great to have you here. Before we talk about this major new investment, tell us how the Shedd is doing right now after the double whammy of the pandemic shutdown and now the Omicron surge.
Well, thank you for asking. You know, the minute we could safely open almost a year ago, January 26th, after being closed for over 200 days, we saw that community need to come and connect with animals. So we just had an amazing Martin Luther King weekend where we welcomed with time tickets and vaccine cards and masks just about 30,000 guests. So we are open and just wonderful to have the community back here at the aquarium.
30,000 guests over the weekend. How does that compare to a typical holiday weekend pre-pandemic?
We are back to pre-pandemic attendance levels, which is extraordinary. Of course, what hasn't come back are school groups. They started to come back right before Thanksgiving, and with the shifting and with, as you say, Omicron, we have seen them, of course, have to pull back from field trips. But we know as soon as they are able, they will come. We saw it and we'll see it again, I'm certain of it.
And as you mentioned, a great need in a time like this to reconnect with nature. And talk us briefly through this major centennial commitment in terms of the physical transformation of the shed.
And that centennial commitment is a $500 million, 8-year endeavor, as you referenced, to revitalize and renovate our historic galleries, but also to really programmatically amplify our mission, not only here on site at the aquarium, but out in community, on the water. And those programs are ready and going to be launched in the coming months.
And we'll get to that in a second, but tell us about the physical experience that visitors will witness once this project is done.
We're focusing on certain areas. First, making the guest experience more accessible, easier to navigate, and far more participatory. When you come to the revitalized exhibits, you will have all 5 of your senses taken into life beneath the waterline. You will see bioluminescence from fish that live deep in the sea where no light penetrates. You'll be able to taste salt water from around the world. You will hear the gulping of a fish and commune with animals like you never have before. We think really there is a nature gap. And if we can close that nature gap with empathy for animals, we can elicit everyone's help, harness everyone to fight this biodiversity crisis that we all share.
And I think we just saw a picture of the proposed aquarium that'll be overhead when you walk through, basically. How unique is that going to be?
Part of the journey will be through a 35-foot-long tunnel where the biodiversity of life, a Caribbean reef rich with sharks, corals, dance around you. It's like scuba diving without a tank, and you will be transported from the terrestrial world to the aquatic world.
And what about...
Also gonna,
go ahead.
We're also going to complement the exhibit experience with a brand new learning commons. Currently, our classrooms are in the basement. They're very hard to get to, and we are going to elevate them to the main floor, open up currently blocked windows that have the world's best view of the Chicago sightline and Lake Michigan. And in that learning commons, set up STEM-rich experiences for not only school groups, but a general guest to participate in.
And speaking of school groups, you mentioned another prong of this plan is education outreach, changing your mission with regards to that, and field-based research. Tell us how those will change.
Some of the programmatic elements that we have started even last summer are partnership programs, for example, with Project Exploration. It's part of a collaborative that the mayor has stood up with, getting youth groups out of school time. So Project Exploration is for girls, STEM girls. My heart is there, being a biochemist myself, and working with Project Exploration, and then teachers in training at Northwestern to teach marine biology, to teach informal science education, and to do it in the Austin neighborhood, as well as then welcome them to the aquarium when we're open.
So significant outreach there to Chicago Public Schools. We mentioned $500 million. That is a lot of money. Is that already raised? Or are you going to have to raise most of that going forward?
The aquarium's always been very measured in its approach to large financial projects. We're using a balance between fundraising, between the endowment, and of course, the more we raise, the more impact we can have. And really looking at that impact, not only for the revitalization of the galleries, but that construction project alone will provide 2,000 jobs to Chicago. And we have set aggressive goals for women and minority-owned businesses to participate in that economic revitalization that the Centennial Commitment will create.
And how long do you anticipate this taking, and will the museum be open during the renovation?
We're doing a phased approach. The construction will happen over about 5 years in 4 phases. The historic galleries will always be open. We'll close sections at a time, work behind the scenes, but always have something for the community to see, and then have multiple ribbon cuttings over the course of those many years. It's going to be amazing to participate in, and there will be something new each time you come back.
And Bridget, before we go, I have to ask you about the Shedd penguins. I mean, they're such big stars at this point. I assume they have talent representation. How are they doing?
The penguins are great. We let penguins be penguins. And while the world only recently discovered them through our social media postings, their enrichment field trips happened years before the pandemic. We took them to Leary Children's Hospital, for example, as part of the wellness and healing for the children patients there. And now we just make sure that we capture their wonderful explorations and bring lots of joy to lots of people around the globe.
Certainly amazing animals. And our thanks to Bridget Coughlin. Thank you so much for joining us.
Thank you.
And up next, an art show in an unexpected space, so please stay with us.
A unique collaboration is bringing black art to a popular Chicago building. It's a first-of-its-kind exhibit happening now at 12 Peru, also known as Prudential Plaza, downtown.
The exhibition at 12 Peru is an introspection of Chicago, and it covers everything from jazz to blues to energy, introspection, and landscapes depicting the Great Migration. So it's everything Chicago has to offer.
Walk into 12 Peru at Stetson and Randolph in the Loop, and the first thing you'll notice is art. It's not unusual to see art in downtown lobbies, but most of the pieces here are from a black-owned art gallery located in Bronzeville.
It's all about inclusion, and we have found that 12 Peru invited us out. We work with Kiana Barrett and Keith Douglas and a host of others that helped us understand the importance of making sure that we were a part of a corporate entity. And so here we are in 12 Peru exhibiting our work, allowing our artists to have exposure that they would not normally have.
Sterling Bay and Gallery Guichard teamed up to create this one-of-a-kind free art exhibit. The goal is to showcase black artists and bring their work to an audience that may not have been exposed otherwise.
This time last year, we were at a critical intersection with the height of the pandemic, as well as a reckoning around race and social justice. And so we were really intentional about how could we utilize this as an opportunity to go from a moment and to create a movement of change.
The exhibit, titled African Diaspora, Chicago, features 20 collage and acrylic mixed media pieces, all related to Chicago. It opened in May, and a new collection of pieces just went up in November.
We were very intentional and very thoughtful about how we could immerse and invite the tenants in our building, as well as the movement of Chicagoans and tourists across the space, to really be able to see the art form, to be have their interest piqued by it, and hopefully then to be motivated to open up their checkbooks and to purchase some.
We've actually sold 5 pieces, and 25% of our exhibit sold. 5 out of 20, we were able to then expose our artists to people who would not normally get an opportunity to see the artwork.
Sterling Bay and Gallery Guichard say they hope to build on that new exposure and stimulate economic growth for black-owned businesses and neighborhoods.
We've noticed more tourism coming through Bronzeville, looking at the gallery, and we're surmising that they're probably seeing it here first and then being able to come to the gallery.
For Sterling Bay, the collaboration with Gallery Guichard is the first of many.
This is a signature initiative for us as well, and what we're hoping is that this will be the impetus to a series of collaborations such as this, not only within our own portfolio of properties, but we want to set the bar across the industry. As we think and we talk about diversity, I always say meaningful, measurable diversity has to be making the word not only a noun, but a verb. There has to be action behind it.
The Guichards also hope the exhibit can be a reminder of the power of art and the impact it can have.
That's really our motto: see art, love art, buy art, live with original art. and our artists of the African diaspora and multicultural artists are able to help us in a way that is really important during this time of COVID.
The exhibit at 1-2 Prue runs until May 22nd. We have more information about the exhibit and Gallery Guichard on our website. And we're back to wrap things up right after this.
Chicago Tonight is made possible in part by Alexandra and John Nichols, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
And that's our show for this Tuesday night. Don't forget to stay connected with us by signing up for our daily briefing. And you can get Chicago Tonight streamed on Facebook, YouTube, and our website, WTTW.com/news.
You can also get the show via podcast and the PBS video app. And please join us tomorrow night, live at 7. A look at the stress parents are under amid the pandemic and advice for dealing with it.
Plus, our Spotlight Politics team on the latest name thrown into the Illinois race for governor. Now, for all of us here at Chicago Tonight, I'm Brandis Friedman.
And I'm Paris Schutz. Thank you so much for watching. Stay healthy and safe, and have a great evening.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm that supports free educational initiatives in the legal profession.